Good morning, doctor. Dr. Sridhar, can you hear me? Vaishnavi, can you hear me?
Good morning, madam.
Yes, ma'am.
Good morning, doctor.
Yeah, hi.
For all the delay, some technical glitch we had, and then miscommunication. We were waiting for your reply. Something like
Okay, okay.
that.
No problem. I
Okay.
had it in my diary, so I was ready.
Okay.
Yeah,
But
excellent.
Karen was very sure. She said, no, ma'am, doctor will come. But then we were calling you to confirm. I think students are they are more positive than us.
That's good.
And
That's good.
okay. So Vaishnavi, yeah, you start.
Yes, ma'am. Good morning, everyone. Our resource person for today is Dr. Sridhar Vaidiswaran, who will be addressing us on the topic geriatric mental health. He has done his MD in psychiatry and he's a member of the Royal College of Psychiatrists. He is the assistant director and consultant psychiatrist in dementia care in Schizophrenia Research Foundation, SCARF, Chennai. He's a clinician with interest in applied research in dementia care in low and middle income country settings. He runs a special clinic for elderly with mental health problems and dementia in SCARF Hospital, Chennai. His current research areas include implementing cognitive stimulation therapy for dementia in India, supported by the Global Alliance for Chronic Diseases and funded by the Indian Council for Medical Research, implementing psychosocial interventions for dementia in rural communities in India, again funded by the Indian Council of Medical Research, adapting interventions for caregivers of persons with dementia, which is the START, Strategies for Relatives in India, and with partnership with University College London, testing the feasibility of using hybrid phase humanoid robots in engaging persons with dementia in India, with partnership with Imperial College London, using Android-based app for improving diagnosis for dementia in the community, which is funded by the Department of Science and Technology. Thank you so much for accepting our invitation, sir. We're very happy to have you amongst us here today.
Personally, Dr. Sridhar, I know how busy you are, and we are very happy for you. You are the most suitable person to address this topic. So when you accepted, we were very happy, and for your presentation because it's mainly commemorating the World Mental Health Day. We are doing this webinars, which we started from infant mental health and ending with geriatric counseling. I think to adopt to our team access to everybody and to the mental health to all. I think you're the most suitable person, and you have the brand with the scarf. So scarf is a brand. It is for the competitiveness, your work efficacy and work ethics. I should say very few people in this all. I mean, I'm not only talking about the medical, very few people have this kind of in their area, have this kind of competitiveness and efficacy and ethics. That's a brand of scarf. We are very, very happy, and you should join us more for the benefit of our students to share your expertise. Thank you, Doctor.
Sure, madam. Thank you so much for your kind words. I'm really pleased to be here, and I'm really happy that you have chosen this topic. As I mentioned in my email, and I also when I spoke to your student, it's an important topic. I think it's something that it's very close to my heart, so I'm quite happy to talk about it today. So can I start, madam? I'll just start my presentation.
Yes.
Yeah, can you see my screen?
Yes.
Yeah, okay. I just try to keep it, if I move very fast, please do let me know. I think there are a few bits and pieces which I would like to emphasize upon. And if anything is unclear, of course, I'm quite happy for you to contact me at the end. Again, I've pitched it at the level for the students. So if it's too basic, please do forgive me for that, madam. It's not for professionals at this point in time.
Not at all, Dr. Shikhar. I know how your presentation, we have tasted your presentation, I would say. So students will definitely enjoy its wealth of information. And I just
Sure.
want to inform you that this is going on live in YouTube and our department Facebook, so that many people
Excellent.
can join at their ease. That's a purpose. I'm just mentioning it to you.
Sure,
And
madam. Thank you so much.
now itself, I think it's getting full because our limit for Zoom is 100.
Mm.
So rest of the people, they will join the,
Sure.
I think our previous presentation, 400, 500 people join our
Mm.
sessions of webinars. I'm just
Thank
informing.
you.
Thank you,
Sure, ma'am.
Doctor.
Thank you. Thank you very much. So we'll start with, I'm going to start with general introduction to um, elderly kind of issues. So what happens as we get older and why should we think about it? Because I think it's important we focus on it from my general interactions with the general public. I find that many people actually don't think about getting older. We all get into a thought block when we want to think about how will I be when I'm older. And again, the concept of what is old is very variable. Say for all the students who are in their late teens, early 20s, if you ask what old is, they will say when you're 40. And when you're my age in the 40s, if you ask what is being old, I would say 60. And then when I know that when I reach 60, or if you ask people who are currently the 60s and early 70s, they think being old means 80. So we always think being old or being elderly is something which is remote from us, which is very far away from us. The point is, we all start to get old the moment we are born. I think that's a very important message we should all keep in mind. I hope all of you, எல்லாருக்கும் தமிழ் தெரியும் இல்லையா? தமிழ்லையும் பேசலாம்ல? I don't want to just stick to English. There are certain points which தமிழ்ல சொன்னா நல்லா புரியும் எல்லாருக்கும். I hope that is okay. நம்ம பிறந்த உடனே நமக்கு வயசாக ஆரம்பிச்சிடும். So again, that's a very important message. நம்ம எல்லாரும் வயசானவங்க தான். Whatever, however old you may be, it's important that just to keep that message in mind. But for practical purposes, we kind of say that if you're above the age of 60 or 65, then the person is older. Okay, அது வந்து நம்மளோட for other practical reasons to make sure that people get the benefits, their pensions and those kind of reasons, we have a chronological cutoff at 60 or 65, or so on and so forth. So we kind of have arbitrary cutoff, which are not in real life true or valid. So we'll talk about that. So today we'll talk about the context. So why getting older is important. And we'll also talk a little bit about what it means to get older and what it means to age. And then I will touch upon common mental health problems in elderly. But the most important takeaway point that I want all the students to go away with from today's talk will be, what can you do to help? Okay, it is not only to help others, the emphasis on helping yourself, because remember, we are all getting older. I want to mention that particular point. Now, the population is getting older across the world. The World Health Organization or website la poningina, aging and health no link irukku. I would recommend that all of you have a look at it, because that has really very useful information and good infographics. Idella I've just taken, it's a link from the World Health Organization's website. Now, as you can see, very few countries have less than 10%. India la pathina, until the turn of this kind of century, and turn of this millennium, we've had less than 10% of older population, which are if you look at our population pyramid, more younger people and less and less older people. So that's why it's called a population pyramid. Now, that is shifting because one, older people அந்த காலத்துல என்ன ஆச்சுன்னா நிறைய வயசானவங்க வந்து செத்து போயிடுவாங்க. They all get, as we reach our 40s, 50s, 60s, health problems நிறைய வரும். We develop infectious diseases like tuberculosis, other health problems which kind of creep in. அதுக்கு சரியான ட்ரீட்மெண்ட் கிடையாது. People develop complications and then they die. Now, we've been able to any problem much sooner, and we're able to get the right treatment at the right time in many of our population. So which means that population, as we kind of get older, we are able to withstand many kind of complications that come to us. Say, for example, 40, 50 years ago, if someone were to develop diabetes, they weren't picked up. Diabetes இருக்குனே தெரியாது. And then they would have developed complications. கடைசியில வந்து ரொம்ப மோசமா போய் ஹாஸ்பிட்டல்ல அட்மிட் பண்ணி they would pass away with severe complications. But now, with a simple blood test, we can identify if a person has diabetes or not. Again, with a simple set of tests, we can actually identify if a person has a heart disease or not. And the mari, we can identify illnesses early on. And also there is an increased awareness about what is healthy living. So we know about smoking, which causes multiple health problems. We know about the impact of alcohol on our health. We know a lot about lack of exercise on our health. So healthy lifestyles we are actually following, which means that our general health and well-being has improved. So we all tend to live longer. Now, when you look at, I'm sure that we will talk about it in the next few slides. The life expectancy in India at the time of independence. So in 1947, if you look at the life expectancy, that is the expectation that a person who is born at that time, how long will they live? They would die by the age of 40. That was the life expectancy. Okay, but now if you look at the life expectancy, it's kind of crossing 70, and it's going to touch 80 in the next, say, 50, 60 years. So we all are expected to live longer, which means there's going to be more older people. And of course, there are more younger people also. Now that population, the whole cohort will age. So you look at how the pyramid will shift. The young people, you're all going to age. And by the time you reach, say by 2070 or 2080, you'll have a huge number of older population in India. So if you look at the prevalence, the total population, there are about, say, 12%, 13% of older of our whole population is above the age of 60. But when you look at, say, 50, 60 years from now, that will come to about 30%. That change has already started to happen in other countries. If you look at Japan, and North American continent, some of the European continents, people are close to 30% of the population, which is older. Now, that change will happen in the next 40, 50 years in India also. So again, that's important for us to keep that in mind. So we are an aging society. In the history of mankind, but at no point in time has there been so many older people on earth. Okay, so again, that's very important because it's unprecedented. Okay, we just don't know how this will all work out in the future. Again, interesting thing. Again, the time it has taken for the population to double, for the older population to double, it's also increasing rapidly because there are so many of us. So numbers are going up. So again, just some more numbers for you. You can look it up in various websites. By 2050, this is the message. See, right now we have about 2021 estimated data, 2021 census we overall India there are about 10.3% population is older, above the age of 60. That's about 14 crores. 14 crore na உங்களுக்கு number புரியறது கஷ்டமா இருக்கும். சென்னையோட population is 1 crore. Okay, you just take approximately Chennai's population is 1 crore. நீங்க உலகத்துல இருக்கிற இந்தியாவில் இருக்கிற எல்லா வயசானவங்களையும் கூட்டிட்டு வந்தீங்கன்னா 60 வயசு மேல இருக்கிறவங்க கூட்டிட்டு வந்தீங்கன்னா we need 14 Chennai. Okay, so that's the size of older persons in India. Now that's going to become 30 Chennai in 2050. Again, an important point for you to keep in mind. Again, Tamil Nadu at the census we'll have more accurate data. But Tamil Nadu is actually third in the country. I mean, there have been some reports recently, but we'll have confirmed report after the next census. But in India, Tamil Nadu ranks third in the number of older persons. So first is Goa, next is Kerala, and Tamil Nadu ranks third. And again, because of better health that we've been able to provide, improved education for our population. So all that has contributed to people living longer and healthier. So that's an issue. Whether we live healthier, of course we are living longer. Whether we live healthier, it's a question. We will talk about it in a minute. So the first take-home message that I would want all of you to go away with is that we are dealing with more older persons. So as a professional, if you're going to be a psychologist, you're going to be any mental health professional, you're going to see much more older people in the community. So unlike any of your teachers, any of your professors, we all haven't seen that many older people when we trained or when we started working. Now we are seeing more, and you will see more and more older persons. So you'll have to be prepared for that. Okay, that's the first take-home message. So second, we move on to the next concept of what it means to age. What is aging? What do we know about it? So there are clearly three important components of aging. First is the physical component. Second is socio-economic aspects of aging. And then there is a psychological aspect of aging. So we will kind of briefly touch upon this. Physical aspects of aging, அதை பத்தி ரொம்ப சொல்ல வேண்டாம், எல்லாருக்குமே தெரியும். So it's very obvious when you look at a person whether the person is older or not. Again, there are challenges. You may look at a 60-year-old and may think that he or she may be in their 40s or 50s, whereas you may see somebody in their 40s and you may think they are in their 60s. So again, the point is there is a lot of diversity. Not everybody ages the same way. Again, that's a very important message. You may have a very fit, 70-year-old person and a very unfit 50-year-old person. So the 50-year-old person may அவங்களோட functions, அவங்களோட general body status எல்லாம் பார்த்தீங்கன்னா they may be worse than a 70-year-old health. Okay, so will you call them being older? They may be frailer. So the whole concept of aging has been twisted on itself, and we now talk more about frailty than getting older by number. So you may have a 50-year-old person who is very frail, whereas you may have a 70 or 80-year-old person who is very fit. Okay, so that's again very important for us to keep in mind. So 60 வயசு ஆச்சுன்னா எல்லாரும் இப்படி தான் இருப்பாங்க, 80 வயசு ஆச்சுன்னா இப்படி தான் இருப்பாங்கன்னு we shouldn't make assumptions. So that's an important point that you should all keep in mind. So the other issue is, even within a person, different organs will age differently. So you may have a lot of gray hair when you look at someone, but they may have a very healthy heart, okay, and really good pair of lungs. So their cardiorespiratory functions are very good. Their muscles are quite strong and fit, and they can do a lot of activities, but their hair is gray. Okay, or they may have some eye-related issues, but otherwise they are fit. So in a person, as they're getting older, not all organs deteriorate or decline in its function, in their functions in the same rate. So different organs will age differently. It depends on various other health issues, அவங்களோட lifestyle, அதெல்லாம் will contribute to that. So again, it's important to remember that. So don't make assumptions. ஒருத்தவங்களுக்கு வயசானவங்க முடி நரைச்சு வந்தாங்கன்னா அவங்களால இதெல்லாம் பண்ண முடியாது, they are not fit for certain activities. Those kind of assumptions which we make when we look at an older person, that needs to change. Again, this is an infographic from the WHO website. So you'll have somebody who is older here who needs a lot of assistance. They are bed bound. They need to be fed and all that. Whereas you may have a younger, a slightly older person who is as good as a younger person. They can they are going to the gym quite regularly. They are being very active and all that. So it's again we need to keep that in mind, that people age differently. Okay? So that's about physical aspects of aging. Now coming to the social aspects of aging, or socio-economic aspects of aging, the first important issue that older persons face in the society is about dependency. So people become more dependent on others. அவங்களுக்கு so they are not able to see very well. So அவங்களுக்கு பேங்க்கு போகணும், they want to look at their bank account, or they need to do something online. They need someone to help them with that. Okay, or they may have a hearing impairment, and so they are not able to take a phone call, or when somebody comes to them and talks to them, they are not able to understand very well. So they need somebody to help them with those processes. They may become a bit frailer. They are at risk of falling down. So previously they would go out and visit their friends or family members, or they may go out to place of worship. So they may go for a regular temple visit or a church visit, or going to the mosque quite regularly. But unfortunately, as they are frailer, they are older, and they're not able to do many things, family members or people around them may have to provide that extra help for them. So they're dependent on others. So dependency is an important issue which many older persons will face, the social issue. And what that does is that it actually makes them a bit vulnerable. Imagine if you're all young students, and we all kind of take many things for granted. You have you need to go somewhere, you want to go and visit a friend, or you have an appointment today for an interview or something. You can manage to go by yourself most of the time. Okay, you don't have to ask anyone. You just kind of get ready, prepare, and then you go. Whereas for an older person, even if they want to do something, they need someone else to assist them with that. So that extra help, which makes them dependent on others, has a lot of social and psychological impact on the older person. We'll talk about that in a minute. The next important issue in aging is isolation. Isolation happens because of many reasons. One, the family members, family members, they move away. So children, They all, graduate, they find jobs, they get married, and then they all move away from the family home, and the people die. So the spouse or other relatives, they pass away. அவங்களோட siblings may die, or their friends may pass away. All these things will cause a lot of social isolation for people who are older. Financial issues. This is big because many people அவங்களோட earning குறைஞ்சு போயிடும் because they are not able to work. They may be receiving a pension, and many older persons, especially if you look at unorganized sector, they just don't get a pension. So there's no financial backup for them. There's no financial stability for them, and that causes a lot of issues for them. And they also become, because of that, they may become dependent on others, and that creates a layer of problems for many older persons. And also அவங்களோட financial needs may get worse. So because if they, as we get older, we may develop a lot of physical health problems. They may develop diabetes or hypertension or heart disease or something like that, which means they need to spend more money on health related issues. So which again, makes them more vulnerable for financial problems. Ageism. Number community, society, it is there. We may say as a society in India, we all respect our elders, we take care of our elders. அதெல்லாம் கரெக்ட், அதெல்லாம் வந்து பேச்சுக்கு நல்லா இருக்கும். But in reality, there is a lot of ageism in our society. You just imagine, I mean, this is a real story I've heard. One of my patients who is a bit older, who is a bit forgetful, வெளியில தனியா போயிட்டாரு. வெளியில போயிட்டு என்ன பண்ணிட்டாரு, he fell down and broke his hip bone. Now because of that, he had to be admitted in a hospital. Particularly in the corona season, he had to be admitted in the hospital. There were lots of issues, worries about that. And then the family members and the people around him, அவங்களோட மெயின் கன்சர்ன், வயசான காலத்துல எதுக்கு இதெல்லாம், வீட்டுக்குள்ளே இருக்க வேண்டியதானே, உட்காந்து சாமி புத்தகத்தை வச்சுட்டு உட்காந்துதான் போறோம்ல அப்படின்னு. That's the kind of expectation. That's direct result of ageism. We have certain preconceived notions about how older people should be, and then we impose that on everyone else. That's what ageism is. If you look at any term like racism, casteism, those kind of things, ageism is very high, along with other isms in the world. And ageism, actually, unless you are there, unless you experience it, you will not know the impact it has on you. And to say that because you are older, you cannot do this, and that actually causes a lot of psychological issues for older persons. So that's again something which we need to think about very carefully as a society, as individuals. How much do we contribute to that? The other bit is about pessimism and nihilism. வயசானா அப்படிதான் இருப்பாங்க, ஒன்றும் பண்ண முடியாது, விட்டுடுங்க. ஓகே, தட்ஸ் அகைன், அவர் காது கேட்கல, வயசாச்சு காது கேட்கல, என்னங்க பண்றது, கண்ணு தெரியல, வயசாச்சு கண்ணு தெரியல, அப்படியே விட்டுடுங்க. I mean, I've seen this happen, even though it's a very treatable problem. அவங்களுக்கு, they may have a cataract, they may have a very simple issue, they just need to change their glasses, they need to use a hearing aid, but people don't do it. வயசாச்சு அப்படிதான் இருப்பாங்க, விட்டுடுங்க, எதுக்கு போய் செலவழிக்கணும், எதுக்கு போய் காசு செலவழிக்கணும் உங்களுக்கு, அப்படியே the family members say that. I've heard it so many times. It's all coming down to ageism, a lot of pessimism and negativism about how what will be useful for an older person, and there's a lot of nihilism about what will work for an older person. So these are social aspects that we need to think about. And of course, abuse and neglect, which happens a lot in older persons. It could be due to all the other factors, because they are dependent on others, because they are isolated, because there's a lot of financial issues, and because there is the ageism and there's pessimism and nihilism in the community. All that directly results to abuse and neglect. Okay, and it's very when you see a person being abused and or having experienced abuse, it's quite heart wrenching when you hear those stories. We will not spend too much time on that today. Next, you look at psychological aspects of aging. Now, this is kind of depending on a lot of things which we already talked about: the physical aspects of aging, the social aspects, the socio-economic aspects of aging. All of these things has a direct contribution to how we feel mentally within ourselves as we get older. So it's also, these are external factors which operate. There is also a lot of things which operate within us, which contribute to how we feel when we get older. You all must be familiar with Erik Erikson's stages of psychodynamic, and it of course is derived from psychodynamic theories. And we talk about when we are in our 40s, 50s, 60s, we talk about being productive in our career, uh, contributing to a lot in the to the community and society, to the family, to others, and things like that. So it's generativity அப்படிங்கிறது தான் அவரோட கான்செப்ட். How much are we able to generate? How much are we able to provide to others and provide to the people around us, and also to ourselves in a meaningful way? Now, if you haven't done that very well, if you're not very satisfied with what we have done, that results in, you get, I mean, that's what we call a generativity versus stagnation is the stage, the seventh stage in Erik Erikson's, theory. Now, people get stagnated at that level, and people have a lot of regrets about what they haven't achieved, what they haven't done, and things are probably because it wasn't planned very well for their life. So when they don't think about it very clearly, when they don't plan what they should be doing with their life, that results in a lot of or virakti. People feel negative about what they have done. They feel despondent. ஐயோ விட்டுட்டோமே, ஐயோ பண்ணலையே, அதை பண்ணியிருந்தா நல்லா இருந்திருக்கும், என் வாழ்க்கையே மாறி போயிருக்கும். அந்த மாதிரி people have a lot of regrets as they get older. Again, it's very important to remember, because all of us are going to face it.
Doctor,
as we get, yeah.
Just sorry to interrupt you. There are some participants who don't understand Tamil, so they have
Oh, okay.
so, and we have a foreigner students also, one or two.
Okay, fine. I'll reduce the use of Tamil words. So as we get older, if we may feel, we may experience a lot of regret, and that is a major psychological issue when we get older. So we need to be aware of that, and we should be able to prevent it for at least for most of us. And when we understand, when we look at an older person who is coming to us for help, we need to keep that in mind. What has been their life experience? What did they do in their life? And how satisfied are they with what they have achieved? Okay, it's important for us to keep that in mind when we assess an older person. So it's about what happened in the past, what is happening currently in their life. So how physically active they are, how cognitively engaged they are, how socially active and engaged they are. And again, thinking about what's going to happen to them in the future. How satisfied or have they been with all the things that have happened so far, and how prepared are they with what's going to happen in the future in their own life. So again, it's important to keep that in mind, and these factors contribute to how we age and kind of healthily. And again, these are various theories. I won't spend too much time on this. It's about accepting limitations, accepting what we have done, what we have been able to achieve, and also what we are able to do at this point in time. It's about accepting everything that has happened so far, accept limitations, and there are so many things that we will not be able to achieve and do, and accepting that and renouncing some of the activities and responsibilities. And all this has to happen without a sense of suffering of loss. So we need to kind of think that, oh, I have lost something. I haven't been able to do this, and that's very bad for me. That kind of feeling, or that emotional experience that people may kind of have at that time, that contributes to a lot of psychological problems later on in life. So it's important to remember that. So if you have to look at healthy aging depends on a foundation of health and security. So you need to be really physically healthy, physically active, and you need to have financial and social security. And along with that, we need to have attitudes and adaptive behaviors within ourselves, within the older person themselves, and also from around us. The society has to be, very positive in its attitude and has to be adaptive. Now, I'll tell you a very simple example of what adaptive behavior might be. So you may go out to a shopping mall, or you're in the checkout queue in a busy, so Diwali time, you're in a shopping, so clothes shop, and you're in the counter, and you have an older person in front of you who is struggling a bit, who is taking a lot of time to process everything and pay and leave the counter. Now, what an adaptive, an elder friendly community will do is will help this person. So that shop shouldn't be allowing that to happen. They should make it easier for the older person. So somebody should be assisting that person right from the word go, and make sure that the process is smooth for them. They're not getting confused. And also people around them. So the other people who are waiting in the queue don't get impatient and don't start shouting at this person, to move on and get things done. I've seen this a lot in my own personal experience when you go out and observe. And in simple terms like, you older man, you old person, why did you come out? You should be in the home, in your home, and you shouldn't be doing all these things. So those kind of expressions which people face, and that's something which we need to be aware of. And again, engagement in meaningful activities for the older person. Again, I've seen this happen a lot when you have an older person, particularly with dementia, and people say, yes, you just give them some coloring books, giving some pen and paper. So how many of us have used coloring books? I haven't used it since I left school. And if you're going to give me a coloring book when I'm, say, 70 or 80 and I develop dementia, I'm going to throw it back at your face. I'm not going to do that. Okay. It's not something which I'll be interested in. So what I would appreciate is, if I'm getting older, if I'm developing dementia, I would be, most happy if I'm engaged in a meaningful activity that is meaningful for me. Okay. So again, it's important for me to, for someone to understand where I am coming from and what my interests are, and engage me in activities that are meaningful to me. So that's again very important to keep in mind when you're dealing with older people and providing therapies for them. So you look at healthy aging, the socioeconomic factors, the physical and biological factors, they all interact with the psychological factors, and it's all coming together. Okay, they don't operate in isolation. So it's important to remember that. So we talked about this. We know that by 2050, most of us will be living beyond the age of 75. Okay, and we all have a longer life ahead of us. So on an average, compared to 50 years ago, all of us across the world have 20 extra years to live. Okay, how prepared are we for that? So okay, the current government guidelines suggest that you retire at the age of 60. Okay, and so beyond 60, you're going to live until 80. In the past, say when this policy was made, when the government retirement policies were made, it was made in 1950s, 60s, or 70s at least. Okay, maybe it was revised in the early 80s and 90s. But that at that time, people didn't, when they retire beyond the age of 60, they will die usually by the age of 70, 65, 70. People don't live beyond that. So the government doesn't have to pay pension for this person beyond a certain period of time. Now, if we all retire at the age of 60 and we all are going to live up to 80, most of us will live up to 80. Many of us may live up to 90 or even 100. Okay, which means the government has to start paying pension for this person longer than for the period that they may have worked. Say they may have worked in that organization, say for example, 30 years or so, but they have to pay a pension for a period which is much longer than for the period that they have worked with. So lots of social changes are going to happen. A retirement age may increase in the future for things to work better. Our pension amount may decrease. Okay, only then the system can function, system can work. So we have extra 20 years, all of us. Now we need to be careful, and we need to think about how we are going to spend those 20 extra years. If you don't plan well now, you may live those extra 20 years in ill health, in misery, and with lots of regrets. So you need to think about that. So you may want to start thinking about a new career. Maybe you need to start thinking about more social activities, things like that. So it's all individualistic. So you need to think about what will work for you. So again, we have talked much about this. I will not spend too much time on that. So the take-home message too for all the students will be: the biological, psychological, and social factors all contribute to healthy aging. They don't operate in isolation. We don't look at just physical health of an older person. We just don't look at psychological health of an older person or social issues in an older person. All these things have multiple two-way interactions with each other, and they all contribute to each other. Okay. So moving on to the third aspect of my talk. How much time do we have? I hope we have. Okay, I'll try and finish this sooner. So we talk about various common problems in elderly. So we talk about dementia, depression, substance use disorders. Again, hidden problems. We don't ask. Often, I see this when I supervise junior doctors or other healthcare professionals, they don't want to ask about alcohol use in an older person, and they happily will be drinking in their homes. They don't talk about it. Unless you ask, you will never know. So it's important that substance use disorders, particularly going ahead in the next 20, 30 years, it's going to be huge in our community. Older people using substances. So keep that in mind when you're interacting with an older person. So psychosis and anxiety disorders. These are common mental health problems that we may come across. We'll focus particularly on dementia and depression today. Those are the big public health issues. So 15% of older persons will have a significant mental disorder. Okay, so that's a huge number that we need to be aware of. So 15% of people above the age of 60 will have a mental disorder at some point. So that's again, that's a huge number we need to keep in mind. But having said that, the corollary to that statement will be 85% of people above the age of 60 will not have a mental disorder. Okay, don't assume automatically because someone is older they have a mental illness. Okay, majority of older people will not have a mental disorder, but 15%, which is a significant proportion, will have some mental disorder. Okay. We'll talk about dementia. Dementia, again, it's a disease process. It happens because changes happen within our brains. Brain cells die, they degenerate, because of which the connections within our brains don't work very well. So the person is not able to do many of the functions and activities that they were doing before. That's what dementia is. Now, there are lots of myths about dementia. And unfortunately, I hear this even from many medical professionals that when we get older, we may develop dementia. And there is no treatment for dementia. These are really important myths that need to be removed from our consciousness, from the society's consciousness. Okay, not all older persons develop dementia. Okay? Dementia is not a normal aging process. We confuse slight forgetfulness we have when we get older with being forgetful. I'll give you an analogy. When you are in your 20s, you may be able to run faster. You may be able to do say 100 meters in about say 10 seconds. I mean, that will be really national level record, but maybe 15 seconds for many of us. Okay. Whereas as we get older, when you're in your 40s, you may be able to do that in about 20, 30 seconds. And as you get much older in your 60s or 70s, you'll be able to run 100 meters in about if you're able to do it in less than 50 seconds, that's very good. Okay. Now, it's the same as for your memory. When you're younger, you'll be able to process information quicker. You'll be able to reach conclusions sooner, and you may be able to remember things for a little bit longer. But when we get older, that process may take a little bit extra time. So you may not be able to remember every bit of information that you have acquired. You will not be able to process the pieces of information very fast as you did younger, as you did when you were younger. But doesn't mean that you will not be able to process the information, doesn't mean you will not be able to remember the information at all. You may take an extra bit of time, you may have to note it down, but you will be able to remember that. That is normal aging. Whereas in dementia, the person will not be able to remember at all. Even if you give them prompts, you kind of make notes for them, they completely forget it after some time. So that is the qualitative difference between normal memory loss, which happens with aging, and the pathological processes which happen in dementia that make us forget things. So that's a crucial difference that I would want each and every one of you to remember. The other myth about there is no treatment for dementia, it's false. There are very good treatments for dementia, but there is no cure for dementia. Again, I'll give you an analogy. There is no cure for diabetes. Doesn't mean that we don't go and get ourselves treated for diabetes, because there are good treatments for diabetes. There is no cure for hypertension or BP, whereas we have very good treatments for hypertension. Okay. Similarly, there is no cure for dementia, but there are really good treatments for dementia. And the reason why we should identify dementia and treat dementia is, one, you reduce complications, very similar to diabetes. If you identify diabetes early, you start your treatment, you prevent complications happening later on. So diabetes affects your eye, it affects all your organs within yourself, and you prevent blindness, you prevent your toes being cut off and things like that. Similarly, when you identify dementia early, you start treatment for dementia early, you prevent a lot of complications happening later on. You prevent a lot of behavioral problems. You prevent the person from getting lost Now, you know how many people who are older, who develop dementia, are getting lost on a daily basis? It's a significant number. And that could easily have been prevented if we had identified dementia early and the family are aware of how to manage that. Okay, we could have prevented this whole problem of the older person being lost. So we can reduce a lot of complications, we can prevent a lot of problems, and improve the quality of life for a person with dementia if we identify dementia early. Okay. There are various types of dementia. I will not spend too much time here. I'm aware that we are running short of time. And again, if you look at the numbers of people with dementia, right now we have about say 5 million. Okay, and the number will cross 1 crore by say 2040. We will reach 1 crore mark. That's about 10 million. Okay, so 5 million is about half a crore. That's 50 lakhs. So 1 crore will be by 2040. Will be there. So there's going to be a huge number. Again, 1 crore people with dementia in India. You bring all people across India with dementia to Chennai, all of us will have to leave Chennai. Okay, that's the number of people that will be there with dementia. Okay. The current status, I'm very sorry to say that more than 90% of people with dementia do not receive any treatment. They don't even receive a diagnosis to begin with. Okay. So again, the emphasis is upon changing the attitudes of our community. While there is no cure, that is true. Okay, but there are very good treatments. We always get confused between cure and treatment. Okay, and again, that's a very old model we have from infectious diseases. You have an infectious disease, you have tuberculosis, you can cure it. You have malaria, you can cure it, untreat it. So cure and treatment go hand in hand. Whereas non-communicable diseases, chronic diseases like diabetes, hypertension, or dementia, they are not curable but treatable. Okay, that's an important message that we should all keep in mind. Okay, there is lots of treatments which are available which can actually improve the quality. I've seen this happen so many times. So it's important that we actually make people aware of this. Again, I won't spend a lot of time, but this is a message which, if you're interacting with policymakers, if you're interacting with politicians, people who are going to contribute or think about our healthcare budget, this is something which you need to keep in mind. And also, as an individual, we need to be prepared for this. How much money do I need to set aside if I were to develop dementia in my old age? That will be a very important question. Right now, again, this is an old piece of information. That's almost, this data was published in 2013, which means they have collected data a few months before that. Okay, if you look at this, the approximate cost that is involved in urban regions was about 2 lakhs. Okay, and that number is you need to include the inflation, you need to include the cost of providing healthcare. By the time, say in about 10 years to 15 years time, if you look at the cost, it'll be about 5 to 10 lakhs per year per person with dementia. That's a huge amount of money that many families have to shell out, and that's not something which they can. Okay. So can we prevent dementia? And I would urge all of you to look at this publication, which came out in July, August this year. And this is a very important public health importance of preventing dementia in the communities. And the question is that can we prevent dementia? The point is, yes, we can prevent dementia, but it's not something which you start doing much later in life. It's something which you start at an early age. So prevention of dementia starts the time you are born. Okay. So prevention of dementia starts with proper education. So we know there is lots of data which has come through, which means if people who are better educated their risk of developing dementia reduces significantly. Okay. So in early life, providing children with, sorry, anybody ask anything? Okay.
நல்ல வேலை.
Some,
சரி. இவ ஒருத்தி உன் கூட இப்போ இந்த இதுக்கெல்லாம் வந்தால எம்டி பரீட்சைலாம் எழுதுனீங்களா 2 பேரும்? அவ என்னன்னா அபியா?
Karan, can you mute all the participants?
Yes, ma'am.
Sorry, doctor.
No, don't worry. I'm quite happy people are interacting. It's important to keep our social interaction well, and that actually, if you look at one of the important things is social isolation, which causes dementia, which contributes to dementia. People need to speak to each other. Don't isolate yourself. Okay, and that's a message which came at the right time. So The other important things which we need to do at our midlife will be about hearing loss, and TBI is traumatic brain injury. Okay, traumatic brain injury also is important at an early age. And the common cause for traumatic brain injury in India is road traffic accidents. People traveling without helmets, without wearing seat belts in their cars, contributes to head injury. So that actually increases the risk for dementia later on in life. Okay. Hypertension, if someone has hypertension, get it treated, because that can actually prevent dementia in later life. Excessive alcohol use has to be prevented. Obesity, again, we talk a lot about lifestyle choices. So healthy diet, exercise, avoiding smoking, drinking alcohol within, I would advise against alcohol use, but if you are using alcohol, use it within moderation. And they talk about 14 units per week. Okay, and that too in a distributed fashion through the week. We probably can chat about it later on. The other important factor is late onset depression and social isolation in older persons. So that social isolation is something which we need to start thinking about right from our midlife, but has a huge contribution later on in life. Physical inactivity again contributes in a big way to dementia. They actually equate physical inactivity, that is sitting for long hours, in your home or at work. They equate it to smoking 1 pack of cigarette per day. That's the kind of amount of harm that continuously sitting in one place can do to your general health. If you have diabetes, or if you live in a place which has a lot of air pollution, which unfortunately is true for most Indian cities, so air pollution can also contribute to dementia. Is again an important figure from that publication. You kind of talk about 40% of the risk for dementia can be prevented. So 40% of the factors are preventable risk factors. So talking about education, hearing loss, we just kind of talked about it. If you're able to address these specific issues, we can actually modify 40% of the risk factors to develop dementia. The rest 60%, the risk is unknown. So it's contributed to genetics, it's contributed to other unknown disease processes which happen within our body and our brain. Okay. So we'll quickly move on to depression. About 7% of elderly may have depression at some point in their lives, above the age of 60, and often underdiagnosed, undertreated. Again, it comes with our preconceived notions about how an elder person will be. Because they're older, they're not talking to people, they shouldn't be talking to people. What is the need for them to go out and meet people? And those kind of things contribute and increase the risk for developing depression. And depression worsens physical health problems. If someone has diabetes or hypertension, it makes their depression worse. And if they have depression, it worsens their general health status. And again, there are very good treatments. In fact, we can cure depression. Okay, and we can definitely cure depression. There are very good treatments available. There are medicines which are available. There are psychological interventions which are available, which can actually one, cure depression and also prevent depression from happening. So we have an important role to play in that. So mental illness in elderly, very much neglected, often misunderstood. There are lots of myths about what mental illness in elderly are. We need to be aware of that. We need to address those things. And there are lots of very good treatments which can make a lot of difference to these people. So how can you contribute as individuals, as students? Being aware of it. Okay. Don't dismiss. So you may not be an elderly psychologist or an elderly mental health professional, but you will be dealing with elder persons in your routine day-to-day job. You may have an accompanying, so you may be a child psychologist. Okay, but you may have a grandparent bringing the child to you, and you may notice something wrong with the grandparent. You should be aware of that. Okay, be sensitive to that and address that, because you can make a difference to that person, and in turn you'll also be making a difference to your patient. Okay? So it's important that you kind of do that. Early recognition and management can make a big difference to their lives, to their quality of life, and overall to the society. We all need to be mobilizing support. So whatever that as an individual we can, as a society we can. If you're part of, say, NSS or NCC or any student organizations, again, another important thing is about political activism. If you're part of a political party, I can't remember when during the last general elections, I was looking at each manifesto from each political party, which I don't remember seeing any specific manifesto from any political party talking about elderly people's mental health issues. Okay. Again, we should be, as mental health professionals, we should be active in that. If you're a member in a political party, we should be active in our political life. And I think this is a message which I've learned, working in many other democratic countries, and also having interacted with, a lot of policymakers and people at the grassroots level. Being politically active is not a bad thing, as long as it contributes to the society and in a meaningful way. And removing stigma, you need to be, you should probably, be very active. And again, I've seen this happen a lot of times. We carry a board and walk, in the beach, but that doesn't actually make a big difference. Of course, it increases awareness, but on top of that, it is not adequate. That alone is not enough. We should do a bit more. What can you do? Think about it. There may be more things that you can do to prevent and remove stigma from our society. And being an elder-friendly society starts in your home. How elder-friendly is your home? Is your apartment complex? If you live in an apartment, do you know how many older people live in your apartment complex? What are their needs? Have you been to, particularly in the COVID situation, have you been talking to them? Did you find out, do they have any specific problems? Have they been able to get their vegetables? Have they been able to get their provision? Okay. And that's something which we should be all taking an active role and providing for them. And again, this is the first pandemic we have had in our living experience now. And this is not going to be the last time, unfortunately, we are going to face a disaster or a crisis. Okay, it's just the beginning. Okay, we are going to see more, and we are going to see more older people living in the community. It may be you and me. Okay, living in this community with a need which is not being met, and how prepared are we? How much are we able to contribute? Only if we set things in motion, things will improve. Okay? If we don't do it, who is going to do it? So with that, I will stop. Thank you very much.
Yeah, can we have a 5 minutes question session, doctor?
Pardon me?
Can we have some questions? If they have the
Yeah, I can.
So,
I probably have to leave in about 10 minutes, but yeah.
So if anybody has a question, you can ask. Otherwise,
Good morning, sir.
Good morning.
This is a question. In fact, I have two questions regarding dementia. The first question is it heredity? And the second question is, as you said, we have a normal aging process. What are the indications which will help us to understand that forgetfulness is going to lead to dementia, but it is not the normal aging process which we go through? So if you could say that. Thank you.
Sure. Thank you, madam. I think that's a very important question. And so talking about your first question was about, sorry, can you just say the first question again?
The first question is dementia hereditary?
Hereditary, yeah. Thank you. Not all dementias are hereditary. In fact, majority of dementias are not hereditary. There are some rare types of dementia which can be hereditary, particularly some early onset dementia. So people with dementia starting when the dementia starts when they are in their 40s or 50s, then it's likely that it is hereditary. But when you have someone who has their dementia starting beyond the age of 60 or 65, it's very unlikely to be hereditary, and that's the majority. More than 95% of dementias are not hereditary. So so you don't have to worry too much about it. There are still some ununderstood genetic factors which are being played out, but genetic doesn't automatically mean hereditary. Okay, we all may have a mutation, but that may not necessarily be passed on to our next generation. So we may have a genetic factor, but it need not be hereditary. But having said that, there are very few, very rare types of dementia which may be passed on from one generation to another. That's very kind of rare. And if you have someone who has a young onset in dementia, say in their 40s, 50s, or even very early 60s, then it's worth getting them through the genetic testing processes. And there are, of course, they need to be counseled before we do the genetic testing. and then we may be able to inform the family members about potential risk of developing dementia. But that opens up a Pandora's box, to speak, because as we said, there is no disease modifying agent for dementia as yet, and particularly the type of heritable dementias we're talking about. So when you inform someone that they may develop dementia, what are the things that we can actually inform them? We can actually talk to them about preventing other risk factors, making sure that they are eating healthy, exercising regularly, they don't smoke, they are not drinking too much, and all those factors we already covered. So we can inform them about that, and they can probably get their life have property, there are a lot of financial things. They can put those things in order. They can plan so I may need so much money for my care. So they can start planning for those things. They may start thinking about where I would want to live, who should look after me. Those kind of discussions a person can start having at that time. So next is your question about what is normal memory or cognitive impairment that happens with age, and what is when does it become dementia? That's $1 million question. We don't have a real concrete way of defining it. Now, there are lots of terms to describe kind of a normal forgetfulness that comes with age. Often it's forgetfulness. It could be other cognitive domains also. So memory is one important cognitive domain, but we also have other cognitive functions like use of language, ability to recognize people, objects, and places, ability to coordinate our muscular activity and coordinate actions and carry out activities, plan, think, organize, and perform our day-to-day life. Being socially connected, that's what we call a social cognition. How much are we able to understand what is happening around us in our community, being caring to others, and being responsive to others. So kind of social cognitive skills that many of us have. Now, these cognitive functions may also become affected as we get older, but not all happen to the same extent. Now, even when you look at heart problems which may happen as we get older, we don't have a standard. Okay, we don't have a standard to say that at this age your heart rate will be 20% of what it was at that stage. Okay, similarly, we don't have a standard to say that your memory will be so much when you're 60, your memory will be so much when you're 70. We don't have cutoffs, unfortunately, or fortunately. That's nice that we don't have such cutoffs, because each one of us will be able to do many things, many different things. Now, what we normally do when we get older is, yes, we may not be able to process information fast, or we may not be able to remember a lot of factual pieces of information. But what we will be very good at when we get older is about associating various things. So we become emotionally much more capable than when we are younger to associate things. If I'll give you an example. If you were to ask a young person, how do I go from point A to point B in a city? The young person will be able to give you a very fast answer, telling you the shortest point. Okay, this is the shortest cut. Okay, whereas if we ask an older person, they will tell you, yes, this is probably the shortest route. They may take a little bit longer. They may take extra 2-3 minutes. But what they will tell you is, from their experience, yes, if you take this route at this time, there is a school there which may may delay you. Whereas if you go at a certain time, you will be able to reach faster. So they may be able to take more information, process it, and give you a better quality of information as we get older. Again, there are lots of studies which have shown that creativity increases as we get older. If you look at the writings of many authors, or artwork from many of the artists, as they got older, the quality of that art is said to have improved immensely. Okay, so as we get older, it's not just memory which is important. We focus a lot on memory and remembering factual information. Maybe we are looking at the wrong thing. Maybe we need to look at something different. And it's like comparing a 20-year-old person who can run faster to a 60-year-old person who can't run very fast. Okay, so we are probably beating ourselves with the wrong for the wrong thing. Okay, what we should be doing rather as we get older. So what are this person's strengths? What is their life experience? What have they achieved through their life? So what can they contribute meaningfully to others, to the community? And there is a lot that many older persons can contribute meaningfully in that sense. So we don't have a cutoff per se as to which cognitive function may deteriorate, but the quality of the cognitive impairment drastically differentiates when the illness starts, when dementia starts. As I said, the quality will be very different. So if you actually do the cognitive function test, you will realize that their ability to process information is completely impaired. Okay, their ability to judge or ability to pay attention and focus, that could have been impaired. And they, again, all of that may contribute to their memory, and independently, because changes happening in the medial temporal lobe in the hippocampus, which that's where usually Alzheimer's disease pathology starts. You will see that their ability to register new information is impaired. Okay, and their ability to associate previous information with this new information, that may be affected, because they're linked from semantic areas in the brain to this hippocampal area, to hippocampal region. So to associate different bits of information, for example, if you were to give a new piece of information, you're talking about a new set of furniture you're going to purchase for your home, and you say an older person, they will be able to remember and tell you, yes, I had this kind of furniture when I was younger. I found that this very comfortable and all that. They're able to associate a link, your new information that is coming in, I'm buying furniture, to the semantic and the old memory they have about furniture and the memories that are associated with that, and give you information. Okay. Whereas in dementia, they will not be able to process and link these two bits. That's the pathology which happens in dementia. The association and the links are broken because of the changes happening within the brain. So you will see a qualitative change in how they are able to process memory. Now, unfortunately, many of our cognitive measures are quantitative. We give a score, we give a quantitative measure, and we kind of don't focus. Some of us do. When we kind of do a quantitative assessment, we actually look at how is this person doing it, what is it making them feel, and how they are able to process that information, how are they arriving at that information. And that's a very important piece when you're looking at early dementia. So sometimes when I have people coming to me, sir, this person has a MMSE score of 25 upon 30, or they may say the MOCA, Montreal Cognitive Assessment score of 27 upon 30. I don't care about the score. You may have someone with 27 upon 30 on a MOCA and still have dementia. Okay, those scores are meaningless unless you actually know what their lifestyle is, what their life story has been, and how they process the information. There's a lot more than just scores on memory tests. So I hope I have answered your question in a roundabout
yeah,
way.
thank you, sir. It is not roundabout. It was really excellent, and it is a wonderful eye-opening session. And I am also thankful to you for mentioning about the planning, because to be very frank, I have also reached an age where I think I need to plan for my future. So thank you, sir, so much for answering my question so nicely. Thank you, sir.
Madam, I may have to go just now because I have another appointment starting shortly. I'm quite happy for people to contact me by email if they have any questions.
Give the email ID, sir.
Thank you,
And
madam.
your presentation also, shall we share it in the
Yes, please. I will email that to you.
book, later they can browse. Thank you so much
Thank you.
for joining us.
Thank you, madam. Thank you very much. Bye.
Thank you, sir. You can leave.
Take care. Bye.
Thank you, sir.
Thank you.
So the participants, I really thank the team who have been organizing, working hard for this, our second year MSc students. And thanks for all the participants who were present. I know there are some questions which is unanswered. We'll definitely send you the mail ID of the Dr. Sridhar. You can send the questions. I think he will be answering definitely. Thank you. So for Kritika, your question I would like to answer. If I'm a forgetful person from my childhood, I get a dementia. No, I don't think there is anything between your memory and dementia. So it's more of a dementia is more of a biological process. There is some kind of a brain damage due to various reasons. It may not be forgetful, but we can work definitely why you are a forgetful person. but there's no connection between being a forgetful person or don't have a memory. Doesn't mean you will get it.
Okay, ma'am. Thank you so much, ma'am.
Priyambada, yeah. So how do we contact you to send the mail ID? Maybe we'll put it in the Facebook. You can browse the Facebook and then you can get it. Priyambada. Thank you all. Thank you for joining us. I hope this was a helpful or a useful session for everybody as students and members of this society. We have to really work more, do a lot of preventive work and bringing awareness. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.